Good evening, all of you, and welcome to my channel, NutraManagement. Today we discuss acid as diet and renal stone. Actually, diets are also divided into two types. One is known as acid as diet, and other one that is alkaline as diet. Acid as diet, that means after the metabolism of such diet, the residual amount which is remain after complete metabolism of this diet is actually acidic substance. Mainly sulfuric acid, phosphoric acid are also produced. And that is responsible to decrease the pH of the blood as well as pH of the urine, which is known as acidic pH of such body fluids. And therefore, this diet is known as acid as diet. Now, today we like to discuss about the different food items which are included under acidous diet, how this acidous diet can able to influence the urinary chemistry, how such acidous diet can influence the kidney stone formation, and lastly, we also discuss about the dietary strategies for the prevention of renal stone. Now, introduction of renal stone. Renal stones are also of several types, mainly calcium oxalate renal stone, which is about 70 to 80% in Indians. And then calcium phosphate stones, which is mainly associated with the alkaline urine. Uric acid stone, that is in case of acidic urine, it is most common. White stone, which is mainly due to urinary tract infection of different microbes, and such stone formation is also elevated in case of acidic urine. Cystine stone, which is linked with genetic disorder, and that cystine stone formation has a significant linkage with acidic urine. Now, what is acidous diet? Acidous diet, that is the metabolic end product of such diet, can able to produce several acidic substances. So acid producing potentiality of this food is maximum. And acid residue mainly originate from sulfur containing amino acids present in the animal protein like methionine, cysteine. Similarly, such acidous diet can able to produce phosphorus containing compounds. And these are acids, that sulfuric acid, phosphorus acid, which try to deviate our blood pH, and to maintain that pH, a load is also imposed on the acid-base balance. And to balance it, acid-producing foods can able to increase the metabolic acid load on the kidney, and thereby the urinary chemistry is also affected, where the urinary pH become less than 5.5. Now, we discussed that what are the acid-forming foods under acidous diet. The major ingredients of such acidous diet are red meat, poultry, fish, eggs, cheese, processed foods, refined cereals that contains large amount of sulfur containing amino acids as well as phosphorus compounds. And such sulfur amino acids and phosphorus compounds, which are responsible for the production of sulfuric acid and phosphoric acid, can able to clear from the blood through kidney, which influence the urinary pH that become near about 5.5, which increase the renal stone formation. Now, that alkaline acid food, alkaline ash foods, which is the other side of the same coin. The ingredients of alkaline ash foods are fruits, vegetables, potatoes, legumes, green leafy vegetables. Why these are alkaline? Because such food items contain high level of potassium, magnesium, and citrate. Citrate is most important because it can bind the calcium in urine and thereby it prevents the crystal formation. So increasing fruits and vegetable intake raises the urinary citrate and thereby increase the urine pH and it becomes alkaline. Now we like to discuss that what is the mechanism for linking the acid-ash diet and renal stone. Now high acid load in kidney can able to increase the calcium excretion through urine. And when a high level of calcium is excreted through urine, it can able to bind with oxalate and form calcium oxalate. So acid-ash diet, which increase the acidic urine, raise the probability of calcium oxalate type of renal stone formation. Such acid-ash diet also reduce the urinary citrate, and that low level of the urinary citrate also elevate the calcium oxalate formation. So acid-ash diet directly favor the calcium oxalate renal stone formation, and indirectly by decreasing urinary citrate also favor the calcium oxalate renal stone formation. Due to low pH, which is less than 5.5, along with the combination of high calcium, low citrate, as well as acidic urine, favor the condition of stone formation. Now, we like to emphasize the acid-ash diet and calcium oxalate stone. Actually, such acid-ash diet results hypercalciuria, that is excess increase of calcium excretion. Because in acidic urine, calcium reabsorption is decreased and thereby calcium excretion is increased. That results hypercalciuria. Acidic urine also favors the citrate reabsorption from renal tubules, and thereby the urinary citrate is decreased, which is known as hypocitraturia. Hypocitraturia. Such hypercalciuria and hypocitraturia, both these factors are favorable for calcium oxalate renal stone formation. That also helps crystal nucleation at first, and in the second step, it helps the crystal growth, and finally, it also aggravates the crystal aggregation. So, low level of the citrate and high level of the calcium in urine favor crystal nucleation, which is the first phase of the renal stone formation. It also enhances the probability of crystal growth, that is the second phase of renal stone formation. And it also increases the probability of crystal aggregation, which is the third phase of renal stone formation. Now, acidic diet and uric acid stone. Uric acid stones are also influenced by acidic urine. Because uric acid is relatively insoluble in acidic urine when the pH is below 5.5. And in such low pH, uric acid precipitation is elevated. That also favors the crystal formation and ultimately stone development. Now, what are the sources of this uric acid? Actually, high consumption of meat, organ meats, seafoods, which are the component of the acidic diet, can able to provide high level of purine. This purine is present in the nucleic acid, and that nucleic acid is present in each and every cell of that muscle fiber. The purine is metabolized into uric acid, and thus acidic diet contribute increased uric acid production, and ultimately acidic urine environment favor the precipitation of this uric acid crystal. So what is the dietary strategy for the prevention of the renal stone in acidic diet? Because we must consume some amount of fish, meat, eggs in our diet. And side by side, we like to prevent this renal stone formation. So what are the dietary strategies we must adopt for such prevention? Now, first one, adequate hydration. We must drink water about 2.5 to 3 liters per day. And due to such high intake of water, it results diluted urine. That dilute urine prevents that crystal formation, crystal supersaturation. It also prevents the crystal supersaturation. And thereby, the crystal growth, crystal aggregation is not possible. Second strategy, we increase the fruits and vegetables along with fish, egg, meat, etc. We not only take egg, fish, and meat, but also we consume high level of fruits and vegetables along with it. Because such high quantity of fruits and vegetables can able to provide potassium, magnesium, citrate, which are the alkaline part that can able to prevent the calcium oxalate crystallization. Similarly, animal protein, we do not take excess amount. We must moderate amount of animal protein. Therefore, excessive intake of red meat, poultry, fish should be avoided. Sodium intake should be controlled because high sodium also favors the calcium excretion in urine. And such high calcium excretion again aggravate the calcium oxalate crystal formation. We maintain adequate amount of calcium, but do not restrict this calcium severely because due to low intake of calcium, it can able to interfere the muscle power, it can able to interfere the neuromuscular junctional activity, etc. So calcium should be consumed within the recommended intake level, that is 1000 mg per day. And side by side, we must consume high citrate-rich food like lemon, orange, etc. And such lemon, orange, which can able to supply high level of citrate that prevent the stone formation. So what is the conclusion about this lecture? Acidic diet increases dietary acid load. High acid load lowers urinary pH and citrate. Increased urinary calcium and reduced citrate promote stone formation. Calcium oxalate and uric acid stones are particularly affected. Fruits and vegetables provide alkalineness and protective citrate. Adequate hydration remains the most effective preventive strategy. Therefore, the key message that we like to disseminate to our society, that balanced nutrition, that means acid as component of the diet as well as alkaline as component of the diet. By the balancing of such two ingredients, reduce the dietary acid load and substantially it decreases the kidney stone risk and recurrence. Thank you.